Hey, it's Chris Bowling.
Chris Byer. Morning, CB.
Good morning. I think this morning, what I'd love to talk about is as we're around this open enrollment season, the employee support tools to help an employee figure out which plan fits me best. And
Yes.
there's a lot of technology behind this. And I think you probably adopted this probably more than I did. And I think over the years, we're realizing that for certain clients, especially if you have three plans, I mean, that just gets hard.
Yeah.
And what we need to push is don't just do the status quo. I get comfortable with my copay plan, and I don't even look
And
at
stay
those
there.
because the person
Yeah.
that worked next to me had a bad experience with an HSA. So I'm not going to even going to look at an HSA
Yeah.
versus bringing in your own data, your own healthcare journey, and saying what plan is the right for me and my spouse, for me and my family.
Yeah. And I think a lot of that starts with as we take on a new client, we evaluate how they're pricing and what the value of those multiple plans are. So often, especially self-funded, we see that
Oh,
the HSA and the copay plan are so close together in value, the
yeah.
premiums don't make sense. And so
Oh,
people are always migrating to the easy button, which is the copay plan. And so first of all, we figure out how do we balance that out? How do we build the richness of the plan and the contribution to make sure they stand on their own and they each have their value? And that's something our underwriting team is doing each year for us, which is an awesome tool. But then it comes back to helping the employee understand what's your journey going to be. So we do have some clients that are using that technology where an employee can input, here's my family, here's my expected healthcare journey. I've got these prescriptions. I'm going this many times to see my doctor. Which plan is the best?
right.
And often, as we've talked to clients, even some of the HR directors that use that tool, they're like, I've been on the wrong plan my entire life. And this is why I now understand. But it comes back to that. It's should you have an HSA because of the tax benefit?
Right.
Are you able to weather the storm of prescriptions, right off the bat if you have a high cost med? But often we're seeing that the solution is not just offer an HSA to make it cheaper. It's really a discussion of what's the total risk and what's your healthcare journey. And I think that was a mistake that our industry made many years ago was
Absolutely.
HSAs are going to be less costly, so let's throw it in.
Yeah. And I
And
think
yep,
I think with the new big beautiful bill or whatever you want to call it,
yep,
there's some advantages now, with the HSA that we can have go back to the COVID days, right? That we can have zero cost telehealth.
yeah, that's a huge thing.
If you want to put in a direct primary care plan, we can finally offer that for no cost because now that changes the game. Okay, I can
Yep,
don't feel good. I don't want to spend $150 to walk into a walk-in clinic. Great, I've got free telehealth. And man,
yes,
there's that direct primary care model around you. That absolutely changes the game for an HSA. Because now I can go in, see the doc. They they do your labs for a tenth of the price, and some
yeah.
of them are offering the top 80 drugs of typically why you come in and see a doctor are free. So
Yeah.
game
So you're
changer.
paying what, 50 to 100 bucks a month, depending on the service, depending on who you cover, to have unlimited access to your primary doc. Like you said, some of those drugs included, some of the labs are included.
Right.
That subscription model, we typically didn't see the individual consumer pick up on an HSA because they would forfeit their eligibility for contributions. But now that you could do that, I mean, that's intriguing to our family because that's mainly what we use. It's virtual visits, annual physical, some lab work, and then every once in a while we need to get in because there's something going on. But it's either urgent care or primary care doc today at whatever that build price is. We're never going to meet our deductible after that.
No, no. And I mean, I hate to simplify this, but if you're on a high cost drug that's 7 grand a month, an HSA is might not be the right plan. I'm not saying it's not, it is the wrong plan, but
Yeah,
if you got to just understand, do I have whatever my max out of pocket is in January 1st? Because I'm going to meet it, or I'm going to meet a
yeah,
big portion of it. And I think that's what scares the employees. But then I'm like, but then you're done. I mean, now the
yeah,
rest of the year, yes, you're
yeah,
free, but can you weather that storm in that first 30 days, assuming that you're going to fill that drug? And especially if you have a
yeah,
surgery or if you're having a baby, it's those things, have to get into that decision support tool, which that's why I love the tool because the tool will ask you all the questions, just say, boom, here's your
yeah,
plan.
and you figure it out. Yeah, so as we're going into open enrollment, as benefits teams are doing their open enrollment education meetings, so much of it is talking now about what's your total risk for the year. If you're
Right.
not going to spend a lot on healthcare and you have an unknown, if maybe there's going to be an accident, maybe this is the time to look at it at a high deductible. But if you know you've got costs and you can
Right.
level out that expense cash flow wise, do so. But that is a discussion that has nothing to do with the deductible. That is total cost of risk, payroll deduction, all of that. So
But
yeah, good stuff.
all of this comes back to, are your plans priced correctly? And 9 out of 10 times they are not. If you're relying
Correct. Yep.
on the Bucas to do it, they're not right.
Yep.
We've proven that over and over. This plan is funding the claims for that plan, and if you just price it correctly, let each plan stand on its own, now you've got a big enough variance that it will make this easier. Starts there, and then let's try to help that employee. So
Perfect.
love it,
Well
man.
said, CB.
We'll see you. All right,
Good to
bye-bye.
see you.
You too.